In our series of Docplexus interview, today we have with us Dr. Sudeep Gupta, who is a professor of Tata Memorial Center, Mumbai, and also currently the Deputy Director of ACTREC, the research wing of Tata Memorial Center. Dr. Gupta is an eminent medical oncologist who is also the Secretary of Women's Cancer Initiative Foundation. He has a number of professional and academic achievements and is recipient of many awards and accolades. Thank you, Dr. Gupta, for giving us time. Firstly, I would like to ask you how the lifestyle changes as well as clinical research-based advances in cancer detections play a role in increased number of cancer cases reported in India.
So, first of all, I would like to thank Docplexus for giving me the opportunity to interact with all of you. Your questions are very pertinent. Your first question is about lifestyle changes.
Yes.
And as you know, that India is in a phase of transition. A large fraction of our rural population is becoming either semi-urban or fully urban. And that comes with many lifestyle changes. So the most important lifestyle changes that happen are in reproductive patterns, standards of living, consumption of food, and also changes in the levels of hygiene. So we can take examples of two important cancers to illustrate the impact of lifestyle changes. The first is breast cancer, and if you track the data from population-based cancer registries in India, you will note that the incidence of breast cancer has steadily risen in almost all urban areas, including the metropolitan areas, from a rate of about 20 per 100,000 a few years ago to almost 35 per 100,000 now. And the main reasons are the delay in the birth of the first child as women migrate to cities, as they become urbanized, as they become educated. The birth of the first child tends to get delayed, and there is a significant association between the age at first childbirth and the incidence of breast cancer. The second important contributor to the increasing incidence of breast cancer has been the rate of obesity, especially in postmenopausal women. Other lifestyle changes have also been responsible, mainly the somewhat lowered rate of breastfeeding of children, and also the decreasing number of pregnancies or full-term pregnancies that women undergo. Now, if you take that in contrast to cervix cancer, the rate of cervix cancer has steadily declined in almost all areas of India. And this is again very robust data from population-based cancer registries. And the main lifestyle factor that has contributed to this fact has actually been an improved hygiene and the availability of free running water. I would like to emphasize here that the reduced rate of cervix cancer in almost every region of India has not been due to either population-based screening or due to vaccination. So essentially improved nutrition, changed reproductive lifestyle such that the women are having their pregnancies and their children at an older age, and most importantly improved hygiene have all contributed to the decreasing incidence of cervix cancer. So you see the interaction between lifestyle and the incidence of various cancers is very complex. What I am expecting in the next few years is an increased incidence of lung cancer in women, especially as women take up tobacco use in increasing numbers, especially in the urban areas of our country.
So, some research-based advances in the cancer detection also plays a role in increased number of reports. So, what are the advances in that front?
So, let me say that it is not so much the advances in detection that have contributed to the increasing incidence as much as the propensity of our individuals in the population to approach the healthcare system. So earlier there weren't so many facilities that were available for both diagnosis and treatment. Now you see there are reasonably good hospitals in most of tier A and tier B cities, and that has been coupled with an increasing awareness amongst our population. and they tend to approach the healthcare system at an earlier stage. Although one would like to see vast improvements in that aspect. So I would say that increasing awareness and especially the role of media has been very important in increasing the likelihood of correct diagnosis of cancer in an increasing number of individuals in our population. Of course, you have improvements in diagnostic technologies such as imaging, such as pathology, such as many other modern tests. But on a population-wide basis, I would suggest that they contribute in only a minor manner to the increasing number of cancer cases.
Okay, sir. So your practice area encompasses ovarian cancer, cervical cancers, and breast cancer management. So if you can tell us that what is the current challenges in the detection and management of ovarian cancer in India?
Actually, ovarian cancer is one of the most complex cancers to treat. And the challenge, not only in India but worldwide, is the fact that there is no good way to detect ovarian cancer at an early stage when it is curable. So most patients in India and worldwide are diagnosed when the tumor has already spread to the peritoneal cavity with ascites, with other organs and other peritoneal surfaces involved. And what that does is to immediately bring down the rate of long-term survival to only about 30 to 40%. There have been a number of efforts at trying to perform systematic and effective screening for ovarian cancer. And most recently, we had a large study from United Kingdom that actually tested the use of a blood tumor marker called serum CA-125, as well as the use of sonography of the abdomen. But unfortunately, even in that study and earlier screening studies, it has not been conclusively shown that any kind of screening of normal women for ovarian cancer helps. My suggestion to people who listen to this presentation or to our interaction is to not minimize the importance of non-specific symptoms that women in the perimenopause or older age have when they present to their physicians. So ovarian cancer often presents itself in a very non-specific manner as abdominal bloating, abdominal distension, increased frequency of urination, dyspeptic symptoms, abdominal pain, and unfortunately there is no good early warning sign in this sort of a scenario, but it has been suggested that if these symptoms are acted upon at an earlier stage and at least some preliminary investigations are done to evaluate the possibility of ovarian cancer, the outcomes are vastly better.
Okay, so as you have mentioned, there is no particular screening, and CA-125 screening also showing no promise at all. So only the symptoms that need to be taken care of for the ovarian cancer.
I would like to add one more point, yes, and that is the fact that there is also an increasing awareness that certain genes that are passed on from one generation to the other can predispose to hereditary forms of cancer, and in the case of breast and ovarian cancer, those genes are the well-known genes BRCA1 and BRCA2. And many of you are aware, and all of us are aware, that Angelina Jolie actually got both her breasts removed because she inherited that gene from her parent. So, in one respect, I would like to add a caveat to the question, to the whole idea about screening not being useful in ovarian cancer. If somebody has a strong family history of either breast or ovarian cancers, those women are advised to undergo regular surveillance and some kind of screening for both of those cancers and several other cancers, as the case may be.
Okay, sir. So any such screening or any awareness for the physicians about the cervical cancer that can be done?
So cervix cancer, I would say, is a success story with respect to screening in contrast to ovarian cancer. And worldwide, in many different populations, it has been shown that if the pre-cancerous lesions of the cervix are discovered by a population-wide systematic screening, then the rate of mortality due to cervix cancer can be sharply brought down. And all of us know that the most important test in this regard has been the pap smear. And pap smear is a good test to detect pre-invasive cancers of the cervix, and treating those cancers and intervening at that stage will prevent most deaths due to cervix cancer. The problem in a country like India is that pap smear screening requires expertise, pathology expertise, cytology expertise, and that is not available in every nook and corner of India. So we may need a multi-stage kind of screening for cervix cancer, where patient or where individuals can first be screened with a very sensitive test, and then confirmatory tests can be done to detect or to confirm the presence of pre-invasive or invasive cancers. So at Tata Memorial Center, my colleagues did a large study, a very large population-based randomized control trial, wherein they tested a very low-cost technology called visual inspection of the cervix with acetic acid, VIA. And what happens is that when you apply this chemical to the ectocervix of a woman, the changes in color can alert the person who's doing this test to the presence of pre-invasive cervix cancer. And the beauty of this study was that this test was performed by paramedical workers who had only received training for a few weeks, and it could be effectively implemented in certain populations in Mumbai, in the underprivileged areas. And we randomized about 150,000 women, of whom 75,000 received VIA and 75,000 did not. And the results were presented a few years ago at the ASCO meeting and then published, and the results showed that there was almost a 30% reduction in cervix cancer mortality. So taking on from there, the many state governments and other health authorities have begun to implement VIA-based screening in their states, and recently there has been a move under the leadership of the Prime Minister to implement screening for cervix cancer on an India-wide basis. So I must say that symptoms in women like intermenstrual bleeding, like postcoital bleeding, like vaginal discharge that refuses to go away, need meticulous evaluation, and that would involve a good pelvic examination as well as cytology or biopsy as and when required.
Okay, so the technique you mentioned, that is very promising. So is it being now implemented, or it needs some more bigger trial or something?
It doesn't need a bigger trial. You cannot have a trial bigger than 150,000 individuals who underwent 4 rounds of screening at 2-year intervals. So the testing stage is over. Now the challenge lies in implementation. So you see, in India, we are good at testing concepts and in conceptualizing things, but we are somewhat weak in the phase of implementation. So now what we need to do is to implement VIA-based screening on an India-wide basis, and that will not only, it will have other positive spin-offs. And one positive spin-off will be that everybody will become aware of the fact that a thing like cervix cancer exists. Genital hygiene might improve. Other preventive strategies, primary preventive strategies that are likely to bring down the incidence of cervix cancer might gain ground. So it will help not only in early detection, but I believe it will also help in primary prevention in the long run.
Okay, sir. So you have a research publication titled Breast Cancer in India, a Continuing Challenge. So what are the basic challenges of the management of breast cancer in India?
So as you know, breast cancer, along with some other cancers, is one of the success stories of modern oncology. And if you look at all cases in Western populations, close to about 80% of them, or maybe 75 to 80% of them should expect to be cured of their disease in the long run. That percentage is lower in India, and there are 2 principal reasons in my opinion. The first reason is that women tend to present to the healthcare system at a later stage. So I can, for example, tell you that in our own hospital, in Tata Memorial Hospital, in the early 1990s, the average size of a breast tumor, the median size of a breast tumor was about more than 5 centimeters. Now today, about 25 years later, that average size has become 2.6 or 2.7 centimeters. So you see, this has happened without screening. This has happened basically because of increased awareness amongst the population. But this has not happened in all areas of our country. So you have semi-urban, you have rural areas, you have other areas where women still tend to live with their lump. And the biggest challenge, in my opinion, is to downstage the diseases, the breast cancer disease in India by increasing awareness amongst our general population. So if you have a 48-year-old woman who has a lump in her breast or a lump in her armpit or a nipple discharge, she should not sit with it for 8 months or 9 months or even 1.5 years and then present to the healthcare system. We need that person to present to the healthcare system ASAP so that it can be evaluated and then treated accordingly. The second biggest challenge in India, in my opinion, is the lack of treatment facilities. So, even if people become aware and they present to the healthcare system must be equal to the task of providing state-of-the-science evidence-based care for those patients. And now, as we all know, the bigger cities and the about 20 to 30 cities in India would have provisions for very good treatment. But in a country of the size and diversity of India, I believe that we need to have far many more centers that can undertake the treatment of cancers such as breast, cervix, and oral cancer. So recently we have started an initiative in Tata Memorial Center in collaboration with the government of Maharashtra. And what we want is that at all district hospitals, so there are about 24 districts in Maharashtra, at all district hospitals, the doctors in that district hospital, the surgeon, the physician, and the gynecologist should be able to treat few common cancers such as head and neck, cervix, and breast. And we have partnered with the government of Maharashtra and a private organization through its corporate social responsibility initiative, and we are trying to undertake capacity building in all these districts of Maharashtra. So we are first starting with 6 districts in terms of treatment, but all 24 districts in terms of education and awareness. And we hope that eventually that at the district hospital level, we would be able to undertake the treatment of common cancers. I must also bring your attention to the fact that India has a large number of medical colleges. And medical colleges are a tertiary care ecosystem where with little improvement in infrastructure and training, the treatment of most common cancers in India can be undertaken and should be undertaken.
So you are the Secretary of Women's Cancer Initiative Foundation. So if you can brief the activity of this foundation and what is the role of this foundation in the awareness or the management of the cancer.
So you see, this is one more hat that I wear, and this is an NGO that has been started by a very prominent social activist in Mumbai who is herself a breast cancer survivor. And her name is Mrs. Devika Bhojwani. She is the Vice President of this Women's Cancer Initiative, and the Director of Tata Memorial Center is the President. So this NGO essentially has 2 main mandates. One is the support of underprivileged women in the treatment of their breast and cervix cancers. So we have supported a large number of patients, women patients. That is why our name is Women's Cancer Initiative. A large number of women patients with breast, cervix and ovarian cancers in their curative treatment at Tata Memorial Center. So we provide them with support for chemotherapy, for radiation therapy, for surgery, for other expenses and so on. The second big mandate of this initiative is to undertake awareness as well as training. So towards that end, this organization holds an annual conference in Tata Memorial Center wherein all the oncologists from all over India and all over the world congregate and deliberate on evidence-based management of breast cancer. And Mrs. Bhojwani and some of us have also tried to spread awareness about breast and gynecological cancers in our population. So we conduct road shows in collaboration with our Department of Preventive Oncology. We have undertaken screening camps in certain areas, and in general, we try to raise awareness about breast and gynecological cancers by all the means that we can.
Okay. Thank you, sir. It was nice interacting with you. Our users will be enriched with the knowledge you shared. Thank you,
I
sir.
thank Docplexus for the opportunity and I wish you all the best.
Thank you, sir. To stay updated on our latest KOL videos and interviews, please subscribe our YouTube channel, like us on Facebook, follow us on Twitter. Happy Docplexing.